Hi guys, my name's Allie. I'm the RN here at Summit Rejuvenation. Today I'm going to go over how our semaglutide works, how to draw it up, how the dosage works, and then how the injections work. So first things first, whenever you get your semaglutide, it's going to come in a pretty big package. Reason being is because it has to be on ice. This is a medication that needs to be refrigerated. So be very careful not to throw anything away. You're going to get your needles and you're going to get this small little box. In this box is going to be your semaglutide, which again, you are going to want to keep refrigerated. Semaglutide is a medication that gradually increases. So what I mean by that is your dose is going to go up every 4 weeks. Kind of how the dosing works right here. So weeks 1 through 4, 5 units, 5 through 8, 10 units. And then as you can see, the dose moves up. A couple points that I want to make is you do not have to increase your dose if you are feeling good. Let's say at 10 units, you're losing the weight that you want to lose, you're not having any bad side effects, you do not have to increase your dose. The reason why you can increase your dose is because you're not getting the effects that you should be getting. So some of the things you should experience is appetite suppression, and it should help with your hunger cravings. Let's say at week 3, you are not feeling the appetite suppression or it's not helping with your hunger cravings. We always say you can increase your dose 1 week earlier. So instead of injecting 5 units on week 4, you would be okay to inject 10 units on week 4, increasing your dose a week earlier. A lot of this can be confusing, so if you ever have questions about your dose increase, or if you ever have questions about going back down on a dose or staying on a dose, please reach out, let us know. This is a serious medication, so we want to make sure you're doing it the safest way possible. And then another thing to note is weeks 20 plus is 50 units. This is what's going to be your maintenance dose. So this is the highest that you can get on it is 50 units. It does not go up any more than that. This is a dose that you can stay on until you lose your desired weight. Next, we're going to go over how to draw up from the vial with your syringe. So weeks 1 through 4 is a very small amount. It is 5 units on an insulin syringe, which if you see is just up here. So that's a teardrop amount. So what you're going to want to do is take this needle that you have here. You're going to want to put it into the vial. And then you will see it slowly draw up. I always draw up more than less, and then push it all the way up to the desired amount, which would be that 5 units there. Once this is drawn up, you can inject it into your abdomen. Some women have also injected into their shoulders or their glutes. It's really personal preference, but this is a sub-Q injection, so your abdomen would be just fine. Whenever your dose increases, that obviously is going to go up on the insulin syringe. So for the first weeks, it's 5 units, 10 units, then you go to 20 units, then you go to 30 units. As you can see, your dose can go up to 40 or 50 units. If that is the case, you will be getting different syringes. So I have a larger syringe to show you here. If you are on the highest dose of 50 units, it's obviously going to be a big amount. So you're going to draw up to the 50 units if your syringe is a little bit larger. And then the same way, you put that needle in, flip it over, draw it up to the 50 units. Again, if you have any questions, if you need help with anything, always give us a call. And then as you are close to running out of your semaglutide, let us know so we can place another order for you.